The video describes the technique of carbon dioxide insufflation of the wrist during arthroscopic bone grafting procedures. We insert the arthroscope through the MCU approach for observation. In some patients with scaphoid non-union, the fracture ends may be tightly encapsulated by scar tissue. Therefore, a small periosteal elevator is inserted through the MCR approach to separate the scar tissue around the fracture ends. In the video, the bone defect is visible after debridement of the fracture site. We insert a shaver into the joint cavity through the MCR approach to remove sclerotic bone at the fracture ends. However, if the sclerotic fracture ends are extremely hard, a burr is required for debridement. In some hard-to-reach areas, a small curette can be used for removal. Next, we switch the arthroscope to the MCR approach to observe the bleeding at the fracture ends. We can see uniform and dense bleeding, indicating that the fracture ends have been successfully freshened. We switch the arthroscope back to the MCU approach, turn off the inflow of irrigation fluid, and switch to the insufflator. Parameters are set to a pressure of 5 kilopascals and a flow rate of 10 milliliters per minute. Meanwhile, a drainage needle is inserted through the 6U approach to serve as a drainage channel, helping to prevent gas accumulation in the joint cavity and subcutaneous tissue. A PIVC cannula is inserted through the MCR approach, and the pre-prepared bone chips are slowly pushed into the fracture site. We use a small periosteal elevator to compact the transplanted bone chips. This step is crucial, as the compacted bone chips can effectively support the distal and proximal parts of the skin, ensuring that the fracture fragments do not shift due to positional changes during subsequent internal fixation. In the insufflated state, we can see that the arthroscopic view remains very clear. Even if blood or soft tissue occasionally covers the lens, the gas helps to blow it away. On the other hand, the view without gas insufflation is very blurry, significantly affecting the surgical process. Through our verification, we have confirmed that insufflating CO during arthroscopic bone grafting effectively maintains a clear surgical field, making the procedure more convenient. Thank you very much for watching this video.